I'm Richard Westerby from IVF Daddies, and today we have an amazing guest, Dr. Carrie Wambach, who is going to talk to us a little bit about Ozempic.
Hi.
Hi. So Ozempic is the craze, obviously, for diabetes management,
Only
but
for diabetes.
only for diabetes, but it seems to be having lots of other benefits or beneficial side effects. Losing weight is one of them, which is good for the diabetes and the weight management. But what else do you see is happening with it?
So the way Ozempic and similar drugs are working is it's causing, well, a couple things. So it's decreasing what's called insulin resistance. So it's allowing your cells to respond to a hormone called insulin really well, which is overall making you digest food better, stop turning your carbohydrates into fat. It's making you less hungry. But it also seems to be doing a bunch of other things where it's lowering other hormones in your body that are having these extra effects. So it lowers a hormone called LH. LH is luteinizing hormone. For women who have polycystic ovary syndrome, one of the primary issues is that you have this really high level of LH. And because of that, your ovary doesn't know how to respond and how to get you to ovulate an egg. And when you're taking this medication, suddenly we're seeing your LH normalize and we're seeing your ovary respond much better. So there are women who are on it for weight loss who haven't had a period or a regular period for years, and all of a sudden they're getting regular periods and they're finding out they're pregnant because
Right.
they're suddenly ovulating again. It also lowers your testosterone. It also lowers your insulin. And all of these things are contributing, at least in the fertility world, to these really good quality eggs, to a really healthy uterus, to regular ovulation. And so it's helping a lot. There's some data that it's also increasing the quality of the eggs. And it's a really hard study to do because Ozempic, I don't know how to say this, but essentially, when you take Ozempic, we want you to stop about 2 months before you get pregnant, and we want you to stop about 2 to 4 weeks before you would have a surgery, for example, taking your eggs out. But we're finding out that when you're on it, everything, like your inflammation is low and the quality of everything is so good that we don't know quite how to study it. We don't know when we should be stopping it safely to get the eggs out and have you have a safe surgery, but also get the effects of the good quality eggs. Does that make sense?
Yeah, absolutely. No, it totally makes sense. But I guess the question for me is then, why does taking Ozempic affect surgery?
Because part of the reason you feel full all the time and you don't want to eat, part of that is because everything slows down. There's a term gastroparesis, which basically is like your stomach is emptying very, very slowly. And when you have surgery, we don't want you to have things in your stomach from 24 hours ago or 2 days ago that you could possibly, vomit up or aspirate when you're in surgery. So normally for surgery, we say don't eat or drink for 8 hours. And we say that so you don't throw up when you go to sleep, right? But with Ozempic, we don't know how long you really need to be off it.
How interesting.
And that's the same thing with pregnancy. With pregnancy, your progesterone slows everything down. That's why you get really bloated and constipated and gassy.
There's a baby in there.
And all that stuff. And there maybe is that little baby that's putting pressure. But yes. But that's why we don't want you on during pregnancy, because we don't want something else adding to that slow, and we don't want you to have this increased risk of throwing up. But if you do happen to get pregnant while you're on it, it's not affecting the baby. There's no anomalies or developmental issues. It's literally just for that reason. But it's hard to study in the fertility world because we sort of want, but then it has these things that may be good. So we're trying to figure it out.
I just find it fascinating that with lots of medicines, they're created for one thing, and then all of a sudden other things happen. And you're just like, oh, okay, well, that's a benefit.
Well, it's nice when they're benefit.
Well, it's nice when it's benefit. Normally it's not, right? We can think of others, but in this instance, I think that's.
Oh, I mean, and also it lowers your weight. So a lot of women who have a BMI over 32 have a higher risk in pregnancy. So if you can use it to get your BMI lower before you get pregnant, you have a much higher chance of a healthier pregnancy. So that's also good.
Why is there a correlation between higher weight and complications in pregnancy?
Higher weight is usually associated with higher sugars and poor sugar control. So that puts you at risk for diabetes in pregnancy. You're also at higher risk for high blood pressure and something called preeclampsia in pregnancy. You're at risk for the baby developing anomalies, mostly because of the sugar and the poor sugar control. So if you can get the weight down, it's just all of those risk factors go down by like half. It's amazing.
And the Ozempic can help you with that.
So that's the thing. It's doing all these amazing things. And so we think the inflammatories, everything in your body we think is lower, but you're not supposed to be on it while you get pregnant. And you're supposed to have this 2-month gap.
Yeah, we're looking at Ozempic reducing all of these things, reducing inflammation, which, to your point, I mean, there are no studies on it yet, but from a logical perspective, you lose weight, you're more likely to get pregnant, you have less inflammation, you're more likely to get pregnant. Again, we can't prove it, but from a logical perspective, we recently, so Julio had an accident, he had surgery on his face, and a friend of ours has this hyperbaric chamber. And again, I don't know if the study's there or not, but they were saying that it's helping with cell regeneration and all these different things. And I think that anything that you can do that's beneficial, I mean, we don't necessarily know if it's going to work or not, but anything's beneficial, right?
Everything is about, in our bodies is moderation, right? So if anything is, there's too much, there's too many cytokines, which is something with inflammation. There's too many antibodies, which is with autoimmune, right? There's too much stress, which is too much cortisol, right? Anything that can bring those things down and yes, sort of give you a better environment in your uterus, a better environment around your eggs, a better environment around the baby that's growing is definitely going to be beneficial. It's just sort of hard to quantify how Ozempic specifically does it, right?
But we are seeing that it's working.
We're definitely seeing that it's working.
Which is
pregnancy rates are going up. It should be. It's just hard to quantify it. Everyone asks, right? They're like, should I quit my job? Should I? Yes. And it's like,
yes, always quit your job. Always quit your job if you hate it. Life is too short. IVF Daddy top tip. Don't do it if you don't want to do it. Seriously, right? That's it. I can
get a backpack.
Go around the world. That will reduce your cortisol levels and you'll get fit because you're hiking up Machu Picchu.
Yes. When you're so happy and you have a baby because of all of that, it's just going to be a little hard to take.
A little bit hard to take care of it.
Put the baby in your backpack.
Yes. Anyway, thank you so much.